Understanding rabies, a threat to humans and animals. Rabies is a serious illness. It affects the brain and can be fatal. This viral disease is a global concern, affecting both animals and humans. Rabies is primarily spread through the saliva of infected animals, most commonly through bites or scratches. Understanding rabies is crucial for both prevention and timely treatment. While rabies is considered 100% preventable, it continues to pose a significant health threat, particularly in developing countries. The virus travels from the wound to the brain. Once it reaches the brain, it causes swelling and inflammation. This leads to severe neurological symptoms. It is crucial to seek immediate medical attention after potential exposure. This includes bites or scratches from potentially rabid animals. Early intervention is vital for a favorable outcome. Rabies is caused by a virus belonging to the genus. This virus attacks the nervous system, leading to severe neurological manifestations. The most common carriers of the rabies virus are wild animals. These include bats, raccoons, foxes, and skunks. Transmission primarily occurs through the saliva of an infected animal. This usually happens through a bite. However, scratches, abrasions, or open wounds coming into contact with infected saliva can also transmit the virus. In rare cases, rabies can spread through organ transplantation from an infected donor. Airborne transmission, while theoretically possible in confined spaces like caves with infected bats, is extremely uncommon. Any contact with wild or unfamiliar animals should be treated with caution. It is important to contact local animal control if you encounter an animal behaving strangely or aggressively. Rabies infection progresses through distinct stages, each with its characteristic symptoms. The initial stage, known as the prodromal phase, often presents with flu-like symptoms. These include fever, headache, muscle aches, and fatigue. As the virus multiplies and spreads through the nervous system, neurological symptoms begin to manifest. This marks the encephalitic or furious stage. This stage is characterized by agitation, anxiety, confusion, hallucinations, and hydrophobia, which is a fear of water. Paralytic rabies, while less common, presents with paralysis as the initial symptom. This can progress to coma and eventual death. Prompt medical attention is crucial upon suspicion of rabies exposure. This is regardless of the presence or absence of symptoms. Preventing rabies involves a multifaceted approach. This includes vaccinating pets, such as dogs and cats, against the virus. It is also important to avoid contact with wild animals and report any suspected cases to the appropriate authorities. Vaccination after exposure, known as post-exposure prophylaxis or PEP, is highly effective in preventing rabies if administered promptly. PEP typically involves a series of injections. These include rabies immunoglobulin and the rabies vaccine. Management of rabies infection once symptoms appear is primarily supportive. This is because there is no specific cure for the disease. Treatment focuses on alleviating symptoms, providing comfort, and ensuring the patient's dignity. Public awareness campaigns play a vital role in educating communities about rabies prevention measures. This includes responsible pet ownership and avoiding contact with wild animals.